Health insurance open enrollment is coming up for millions of Americans, and it's important than ever to have health plans that's right for you and your family. And joining us is the Chief Consumer Officer for UnitedHealthcare, Rebecca Madsen, to tell us more. Good morning, Rebecca. How are you?
Good morning to you as well. I'm doing great. Thanks.
Okay. For those who might not know what open enrollment is, please explain to them what it is.
Open enrollment is the time of year when you select the health benefits for yourself and your family for the coming year. It's usually about 2 to 3 weeks during October and November if you have an employer-sponsored plan, and it's usually from the middle of October to the beginning of December if you have Medicare.
Okay. Please, everyone out there, listen very carefully because Rebecca's going to give us some tips on the right plan and also saving money for your family, Rebecca.
Absolutely. So the first tip is look at changes, not only changes in your own life, but changes in the plan. Often year over year, the carriers will change or the specifics of the plan will change. So don't just check a box, spend a little bit of time understanding what those changes are. The second is the cost. Not only the premium, that's the amount you pay out of your paycheck, but also look at the deductible. That's the amount you pay out of your pocket before the insurance kicks in. And often people are surprised when something is under the deductible. And then lastly, look at the coverage. We don't want anyone to get cost surprises, and make sure that you look, are your providers in network? Are your hospitals in network? And are the medications that you and your family take covered by the plan that you're selecting?
It's so important to take a look at that. And also what's very important is, of course, new trends that we saw that we need to be aware of, because during the pandemic, we saw them pop up all over the place. But you're saying, you got to really watch out for those.
Yeah, there's never a more important time than the past year and a half when people are focused on their health. And the first thing that we saw an acceleration in was the use of virtual visits or telemedicine, where you could access a provider 24/7 through your phone, your tablet, or your computer. And not only was it accessible, but provided an avenue for people to be able to meet with their providers even though they couldn't go in person. And it's often more affordable. The second is wellness programs, and it's a great time to really focus on taking care of your health. About 70% of employers offer them with an average of $600 in incentives. So you can get money back in your own pocket and stay healthier by doing things such as walking and coaching. We, for example, at UnitedHealthcare have a program called Motion, where you can earn up to $1,000 in incentives by participating in walking, swimming, health coaching. So money in your own pocket as well as helping you stay healthier.
Well, I'll tell you, this is all great information. I know it's just a little bit, of course, for the viewers to learn, but where can they go get more information?
We have a website, uhcopenenrollment.com, where you can get helpful information and tips to hopefully guide you through open enrollment. And you can always call us as well, where we have advocates on the phone who are ready to help through the process.
Perfect. I'll tell you, it's so important right now, Rebecca, and we thank you for joining us this morning.
Of course. Thanks for having me.